So what I did actually in the previous videos, we actually moved the table towards the wall because in the place that I work, the rooms are pretty good size. So we've moved this table back so easier to see and for me to do techniques. So now I'm just going to be showing you like a basic maintenance massage that I do, emphasizing on how I use my body. And hopefully this can help some of you out in your massage. So I just use a little bit of oil, not much. So I want to be able to grab hold of his tissues. So in warming up, I just do a lot of kneading. So if you notice, I kind of lean forward. I'm hooking and using my arms and using my waist. Now I'm not hooking with my fingertips, hooking his muscle that way. I'm kind of hooking with this part. So I'm not digging in to his side, because that would be a little bit uncomfortable if you do it like that. That wouldn't feel too good. So you don't want to do that. So I'm kind of hooking with the muscle of my fingers and just using my body weight to pull. So I'm not pushing in real deep. I'm just kind of hooking the muscle, just kind of wringing it to kind of put in. Now what I've been doing over the years is working on, after a while you get to know the anatomy of your client so you don't have to look down as you're doing your work. So start looking up and just use your body weight. How to dig in. So we're just warming it up using the body weight. So now I'm here, I'm just going to hook in, using my body weight, pushing, and I'm just moving as fast as his muscles will let me. I'm not trying to force my way that way. I'm just putting my body weight at an angle on his body. I'm not putting weight on his spine, just on the muscles on the side. Just kind of pushing and lightly stretching out. And then again, I'm just kind of using my fingertips. Now, when I say using my fingertips, what I mean is I cup my hand like that. So basically, only this part is touching his body, and I flex that way. Try that out. You'll find that your fingertips are a little bit stronger. Now, when we do some close-ups later on, you'll see that my fingertips, sometimes as they mold to the body, my fingers might do like that. But I'm not flexing them to be straight this way. I'm flexing them to try to become here, so it keeps them stronger as opposed to flexing in that position. You'll probably understand when we get to that point. But again, I'm just kind of working, keep my arms straight, just using my body. Pushing. Again, just use a little bit. If you use too much, you're going to slide, and then you have to flex to kind of control yourself. So just kind of use it just a little bit, in my opinion. So I'm hooking his tissues up, again, using my body weight, not muscling it. Trying to get my body weight to do all the work. Just relaxing my hand, staying away from the spine, just kind of being close to it. Then I get to move once his muscles relax. Now how's that pressure? Is that okay?
That's it.
That's it? Good deal.
Yeah. Perfect.
Good. Oh, now I'm stressed out. I have to keep it perfect. So, by the way, this is the first time I've worked on Sabir, so he's being very cool and helping us out today. I appreciate it. So again, I don't have to look, just kind of know your anatomy. If you have to check, obviously go ahead and check, and then come back up. Save your neck. And then now another thing is, let me finish this stroke here real quick. And I'm just kind of going the speed that his body will let me relax. I'm just using my body weight now to decompress the sacrum a little bit. And hips lower, and coming off. So, there's going to be times when you have to do techniques where your shoulder is rolled forward, like this. This is not great. After 9 hours of hands-on, this can be a little bit tiring and hurt your shoulders. Remember, anything repetitive use injury, you want to try to stay away from. So, sometimes you have to do this, but when you don't have to, don't. Kind of silly, but basically what I try to do when I can is put my hand where it's basically a thumb up, sometimes even to the side, because I want to open up my shoulder. So when I'm doing this technique, thumb up, just kind of relaxing. This hand, this is something I'm working on, so not picture perfect, but I don't want to twist it like this to give myself support, because now I'm going to potentially bother it if I'm working like 4 days in a row or something like that, because I'm not doing a lot of pressure on it, but it's repetitive. So ideally, twist thumb up, keep your hand open or what have you, to open that shoulder up if you're going to use a supporting hand. And I'm not trying to force my way through, because again, that would wear me out in the long run after 9 hours of hands-on by the end of the day. So plus it doesn't feel good to the client. So just relax, use your body weight. As the muscles relax, go ahead and move. And again, thumb up, don't do that. Get to the end, I usually like to just kind of lean in with my forearm. I'm not digging in with the point of my elbow, just pushing with my forearm, kind of just to decompress the whole hip and part of the sacrum there. And then come up. Again, using your body weight. Head up. Now I'm a little bit more lateral and more to the outside of his body. Just kind of following his erectors. And then decompress. So here, kind of hook in, stack bone on top of bone. I'm exaggerating a little bit so you can see what I'm doing. Drop your shoulders, using my body weight to press in. Kind of glance down to see, make sure I'm on the right path. Just right close to his spine, I'm not on it. I want to get a little deeper, so I'm standing up a little bit, just using my body weight. My arms are pretty much relaxed, just flexing enough to stay straight. And I just wait as his muscles relax. I get to move. I'm moving my body because his muscles are wanting to throw my hands, fingertips off to the side, but I want to stay on the inside, so I had to move over here. So you just pay attention to that and just kind of angle your body weight appropriately. And again, I'm just kind of pressing in a little decompression. tight there.
Yeah.
And don't rush it. Almost at the end here. Angle down. What I'm doing at the end is I'm kind of scooping up, pressing down in. So when I get close to the end, so I kind of angle down. I'm kind of wanting to travel up towards his sacrum. I don't want to dig in with my fingernails, so I make sure I get as much of my pad on there as I can. So I kind of angle up a little bit.
So you could actually feel the muscle relaxing as you're going through that movement.
Yep. Can you tell that that's kind of happening?
Oh yeah, I can feel it.
So now the second run, I just do a little bit lateral. Again, hooking in. I'm trying to accent me using my body weight here so it's easier to see on video. I push in. So I'm not really exerting a lot of energy to do this, just using my body weight. But I'm flexing my fingers to be in a cupped position, even though they don't look it, but that's what I'm trying to do. One other little side note just thought of. Every once in a while, work on somebody, this will tighten up all of a sudden because they're ticklish, what have you. So what I'll do, if I find that out, is as I'm working down to that area, I find that more tissue, more touching their body calms their nervous system. Most of the time this works. So if somebody's ticklish, just add more of your hands touching the body, and that may calm down to where they're not tightening up real quick on you. So now, I'm going to do fingertips. Excuse me. So what I'm doing is trying to keep my spine straight, and I'm hooking in, and my fingers are like this, you'll see, but I'm flexing them to be cupped. Okay, so I'm here, hooking in, I'm trying to stack bone on top of bone, then I use my waist to push in. So my arms are relatively relaxed, I'm just flexing them to keep them straight. How's that pressure?
That's good.
That's good.
Okay.
So again, I use my body weight to angle me, or my feet to move me around. If I need to get deeper, I'll just come up a little higher in my stance. Keep your shoulders comfortably low. Feel the tissue. And as it relaxes, I get to move. So now the second run, I just do a little bit lateral. Again, hooking in. I'm trying to accent me using my body weight here so it's easier to see on video. I push in. So I'm not really exerting a lot of energy to do this, just using my body weight. But I'm flexing my fingers to be in a cupped position, even though they don't look it, but that's what I'm trying to do. Head up. I also find that if I keep my eyes off the client, that I can actually feel the muscles better. So that's something to keep in mind as you practice.